It's time to begin this session of presentation. My name is Meng Chang. I am currently a PhD student in the Department of Technology Management at Chung University. This is a special moment. Although I cannot go to Barcelona, I'm very pleased to share my research findings with all of you online. The research finding entitled is Discharge Against the Medical Advice from an Emergency Department, a survey of municipal hospital in Taiwan. Outline is here. And the introduction. When the patient still needs to continue treatment, observation, or hospitalization, but actively asks to leave the hospital, such incidents conceal the risk of medical disputes and also present problems with hospital management and capabilities. The research purpose is to find out the relevant factor in the discharge against the medical advice of emergency department. Concepts of DAMA. The part of the patient who is requested to be discharged from the hospital by the patient or family member, and the doctor has issued an automatic discharge order to complete the discharge procedures, can be divided into two categories: critical AMA and non-critical AMA. Among them, automatic discharge for non-critical illness can be further subdivided into unavailable bed AMA, transfer AMA, and rejected medical treatment AMA. Factors that may affect DAMA: patient characteristic, psychological factors, physiological factors, social factors, medical environment factors. The main reason that affects the patient to leave without completing the emergency medical treatment procedure is the waiting time. Others still have influencing factors such as past emergency medical treatment experience, medical treatment status, medical department, and in waiting time of different emergency departments, doctors' treatment, and communication style. The most common disease diagnosis by patients who leave the emergency department without completing emergency treatment are non-specific symptoms and signs, trauma and external injuries, and disease of the digestive system. In the municipal hospital in Taiwan, we use a task triage from grade 1 to grade 5. Communication. The emergency medical patient relationship has the following characteristic. The medical situation in the emergency room is busy, and the relationship between doctors and the patients is short. Insufficient communication time, often neglecting other medical condition interaction information. The medical patient relationship is difficult to reassess. ED crowding. Let's pass it. Design and data source. A cross-sectional design was used. A retrospective analysis of incidents of DAMA by adults occurring within Municipal Hospital ED of Taiwan was conducted. The review extracted data from 1 January 2016 to 13 June 2019. A total of 1,860 ED DAMA patients were surveyed. The survey of data including age, gender, occupation, way to hospital, grade of triage, type of medical department, waiting time, length of stay, disease diagnosis, DAMA reason. Descriptive statistics were performed, and all variables were categorical and presented using proportions. The rate of DAMA was 2.2%, 1.92 in internal medicine, 0.70 to 27% in surgery. Gender. Male is more than female. About age, is around 60 years old, 50 years old to 70 years old. The peak is at 60 age generation. About the way to hospital, we can see the patient come to hospital by themselves is over half, and then they come to a hospital by ambulance or family members brought them in. About triage. Here we can see the table. Triage grade is at 3. It's almost 70%. The emergency department and triage grade. Emergency medicine is the most popular. Grade 3 and 4 is almost to 70%. Time of patient waiting for consultation. In this hospital, patient wait to see a doctor within 10 minutes, and the length of ED stay time is within 4 to 5 hours. About diagnosis, the first is fever, and then is abdominal pain. Let's see the reason of DAMA. The first reason, refuse to stay in hospital for observation, is about 44%. Refuse to be hospitalization is about 40%. The reason for DAMA has two different types. Unwilling to follow the doctor's advice to continue treatment, like a refusal to stay for observation, refusal to be hospitalized, refusal to check up. Another is willing to continue treatment but want to transfer to another hospital. The reason is too far from home, doctors familiar with other hospitals, and the long-term patient in other hospitals. The first category is internal disease factor. There is a gap between the patient's improvement of the disease and the doctor's connection. The second category is the external environmental factors, such as the patient's personal habits, residence, and the physician's familiarity. Future scope. I have 3 suggestions to reduce the DAMA. One is handle on-the-job education to strengthen communication between doctors and patients. 2 is improve medical quality and technical capabilities. The last one is adjust manpower for ED crowding period. And this is my reference. Thank you for your attention.